name is Leslie Arellano. This is fall 2022, and this is my trach care and suction skill. So I'm going to start off by looking at my MAR. I can see that it is for Kenneth Bronson, 8/11/19XX with no known allergies. His physician ordered trach care Tuesdays, Thursdays, and Saturdays using normal saline at 8 a.m. and a suction tube on bedside and suction tracheostomy as needed at 8 a.m. Okay, so I'm going to go ahead and grab my supplies. I have my tracheostomy clean and care tray, and I have my suction catheter kit, and I have my saline, and I have gloves right here. And there is no hand sanitizer in the room, so I will verbalize hand hygiene. Okay, so I'm going to go ahead and verifying that they're not open and that expiration date and that they're not expired. Okay, so I'm going to go ahead and enter the room. Good morning, mister. How's your morning? Good? Okay, so I'm here because your doctor ordered trach care and suction. So my name is Leslie. I'm going to be your nurse for today, and this is what I'm going to be doing, okay? I know you can't speak right now, so just give me a thumbs up or a thumbs down as your answers. Okay, thumbs up. Okay, if your name is Kenneth Bronson, can you please give me hands up or hands down? Okay, good, thumbs up, and I see his wristband. Is your date of birth 8/11/19XX? Yes, thumbs up, okay. And is it true that you have no known allergies? Yes? Okay, thank you. So I'm gonna go ahead and do hand hygiene, and I'm gonna put on my gloves. Okay, so I'm just going to go ahead and I'm going to take your vitals, okay? So I'm going to go ahead and I would take vitals. I would leave on the pulse oximetry on continuously on his finger. And I'll go ahead and take a list. I put on my stethoscope and I'll take a listen to his lung sounds. I can hear wheezing due to the secretions. And I can see that his pulse ox is 87, so he would require some suctioning. So I'm going to go ahead and provide privacy. I'm going to put the bed down in a working position, and I'm going to put the railing closest to me down. There you go. And I would place myself right here. Okay. I'm going to monitor that that the little tube is inflated, and if it isn't, then I would go ahead and inflate it so that I know that the trach balloon is inflated, and I would go ahead and remove that, making sure that it is inflated. Okay, so I have taken vital signs and I have listened to the patient, so I'm going to go ahead and the continuous suction is right here on the wall. And I'll go ahead and I turn it to 100 to 120. And I have my ambu bag right here. Okay, Mr. Kenneth, so I'm going to go ahead and start your suction now, okay? Okay, thumbs up. Okay, so first I'm going to give you some oxygen, okay? Okay, at this point I would go ahead and grab the ambu bag and I would hyperoxygenate. I would connect to the trach, and for 30 seconds I would give 5 to 6 breaths. So that would be in the duration of the 30 seconds. Okay, so I'm going to go ahead and remove my gloves and perform hand hygiene. At this point I would do suctioning. And I'm going to verbalize this part, but I'm going to walk through the steps. would do hand hygiene. I would remove the sterile gloves, and I would remove the saline tray. So first, I would have already done hand hygiene. My suction is ready at from 100 to 120. And at this point, I would go ahead and I would put on my sterile gloves. I would go ahead and put on my sterile gloves. I already put saline in there before I put on my sterile gloves. And that's when I would go ahead and I would grab the catheter with my sterile gloves. And I would go ahead and grab the suctioning tube. And this will be my dirty hand. So I would go ahead and connect them. I would go ahead, my patient's already sitting up for this, and he's in working height. So they're already connected. I would go ahead and I would do this for no longer than 10 seconds. Okay, Mr. Kenneth, just let me know if something's bothering you, okay? I would go in and I would make sure that I'm not pressing the occlusion so that it's not sucking. I would enter not sucking, and when I meet resistance or the patient starts coughing, that's when I would start suctioning, and I would go in side to side and intermittently press the occlusion. So I'd go side to side all the way out, and that'd be no longer 10 seconds. At that point, I would observe the secretions that came out. They were clear mucus, and I would go ahead and I would make sure to clear the catheter by suctioning some saline, and I would go ahead and I would hear if there are any crackles that I can hear from the trach, suggesting that there's more secretions in there. I can see that the pulse ox, his oxygen saturation went from 87 before suction and is now at 96. So that means that I cleared out his trach. I'd go ahead and disconnect, set it over there, and I would bundle it up the catheter in my sterile gloves, and I would remove them, and I would dispose of them. I would do hand hygiene, making sure that I don't stray far so that the patient doesn't fall. Okay, so I have done hand hygiene. Now I'm gonna go ahead and don on some gloves again. At this point, I would go ahead and I would, again, after suction, I would take vitals. I would listen to the lungs. They sound clear now, and pulse ox has gone up. So now I would go ahead and remove, making sure I'm not in front of the patient. I'd go ahead and remove the trach gauze, and I would assess for coca. I can see that would be color, amount, consistency, and odor. I can see that it is yellow secretions. I'd go ahead and I would bundle it up, and I would remove. I would do hand hygiene, and at this point, I would get my kit ready. I'm going to go ahead and remove my gloves. I go ahead and touch only the 1-inch border. making sure I put shiny side down. And if I want to move it around, I would go ahead and do it by the sides. And I have all my things here. I'll go ahead and make sure that I open up just enough my saline so it's not hard for me to open up later. And I would go ahead and put on my sterile gloves. Okay, so this is going to be my dirty hand. Okay, so I'm going to go ahead and I'm going to place it right here. Making sure that nothing here is touching. That's when I would go ahead and I will remove this just so that I don't break sterility. Okay, so at this point I would go ahead and I would pour saline. Again, making sure this hand remains sterile. I pour saline in all the quadrants and I would set it aside. And I would go ahead and move this over here because that would have broken sterility. So I would go ahead and set it to the side. And then that's when I would have put on my second pair of gloves. And this one I would cuff it. All the way, and then now I would be able to fix it and I would pull down by the inside. Okay, so if these were to touch, that would break sterility as well. Okay, so before I do that, I would like to separate my gauze just so I have no problems later. Okay, so now I'm gonna go ahead and remove the trach. Okay, I would go ahead and only touch it by the top part. I would let it sit. Okay. I would let it sit, and that's when I would grab my thing and I would clean it over the tray. And I would place it on the clean, and I would go ahead and dispose of this. I would dispose of it right there just because I know that's my trash. I would go ahead and only grab it by the top part. Oh. Before doing that, that's when I would have gotten my gauze. And I would have patted it dry. So just pretend I didn't put it in there. Okay, now I would go ahead and put in there. Making sure that as I'm putting it in there, it's not touching the patient's clothes or the neck area. So now that I'm done with sterility, I would go ahead and I would grab cotton and I would touch the saline that is clean, and I would clean the patient's trach area, inwards, outwards. I would dispose of it. Again, I would saline, inward, outward, dispose, inward, outward, dispose, making sure that I'm not in front of the patient. Inward, outward, dispose. And then, so now I'm gonna go ahead and I would place in a new gauze. Okay, there you go. Okay, that looks good. Okay, so I would make sure that I clean up my area, and I just set it to the side. I'll clean it after I'm done. I'm gonna pretend this is a new necktie. So what we are supposed to do is we don't release the old one until the new one is placed. So I would go ahead and place the exact same way. And once it is secure, that's when I would remove the old one and I would dispose of it. As I am changing the necktie, I would assess the skin. I would assess for any breakdown, any humidity, because when the patient is laying down, moisture goes back there. And I would also make sure that I can fit in 2 fingers in between the necktie. So everything looks good, dry, and the skin is intact. So I would be done. I would dispose of all of this per facility protocol. I would go ahead and dispose the gloves correctly. I would do hand hygiene. Okay, Mr. Kenneth, so I'm all done here. Okay? Was that okay? Yes? Okay, so just let me know if you need anything, okay? I'll go ahead and I already did hand hygiene. I would set the table down. I would put up my rating again. At this point, I'm observing the O2 sat. It is, again, it's at 96. I hear his lung sounds, they're clear. His vitals are all good. So I'm all done here. I place him down and I provide the call light. Mr. Kenneth, if you need anything, just go ahead and press the call light and I will come, okay? Okay, and let me know if you have any concerns or any questions or if anything's bothering you, okay? So again, I have disposed of this. I would exit the patient's room and I would go ahead and document that I suctioned, how many times I suctioned, what secretions came out. I would document the coca from the initial gauze. I'd go ahead and document the vitals, how the O2 stats, how it went from 87 to 96, the lung sounds, what I heard, and how patient tolerated the procedure, and I would document trach care. And I would document also date and time and my initials. Thank you.